Today we must consider an outbreak anywhere is an outbreak everywhere. A.J. Parkinson. And I think those are words to remember going forward. Outbreak in China. In a number of days it's going to be in Europe. From Europe it's going to come to the United States, assuming it didn't come from the United States immediately from China. Another lesson we have to learn is our hospital system. You know, we talk about our hospital system. We don't really have a public health system. We have a hospital system. And we learned the hard way about the capacity, the equipment, and the management of our hospital system. New York City, we have only 12 public hospitals. They are the Health and Hospitals Corporation. They're run by New York City. But there's only 12 hospitals in that public hospital system. 44 hospitals are private hospitals. They're private institutions. They're regulated by the state, but they are private institutions. They have their own area of expertise. They have their own basic clientele, and they're doing business as individual entities, like an individual college, right? We have a system of colleges, but each college is individual. It's the same thing with hospitals. Each hospital is an individual entity. Long Island, we have 4 public hospitals, but we have 19 private hospitals. Westchester, 1 public hospital, 12 private. Rockland, 1 public, 2 private. Hudson Valley, rest of the state, 2 public hospitals, 87 private hospitals. So really, your healthcare capacity in the state is all in the hands of private hospitals, right? You have 176 private hospitals in the state. That's the capacity. But that means you have to now rely on those private hospitals, get them all to be part of one system, which day to day, that does not happen. They're operating themselves. We have, again, state regulations that say this is how much you must operate. But they operate as individual entities. In the middle of this outbreak, we had to go back and do what we call the surge and flex management system, where we said to all 176 private hospitals, we have to work together. And we have to manage this system as one, because hospitals are getting overwhelmed. Maybe within the public system, they can share patients and doctors and staff, because you have, in New York City, H&H has 12 hospitals. Okay, you can share among your 12, but we have to get these 176 hospitals now all to work together, even with the public hospital. And hospitals were getting overwhelmed. So now you need a system to share patient capacity, share equipment, share ventilators, share staff. That had never been done. We did this all basically on the fly, and we put together a de facto public health system. But it was a lot to do on the fly, and we need to institutionalize these lessons. Part of what we have to learn is what happened with the equipment. I mean, this was just a situation that nobody anticipated. It happened all across the country. You couldn't get enough gowns. You couldn't get enough masks. We're going to put in a state requirement now that every hospital has to have a 90-day supply, stockpile, their own stockpile, of all the PPE equipment that they could need for a 90-day supply at the rate of usage that we saw with this COVID virus. So every hospital has to have 90-day supply, period. We can't go through this day-to-day moving masks all across the state, right? This mad scramble that we were in and still are in many ways. Also, as a nation, we can't go through this again. There was competition among states. There were competition among private entities to get this equipment. The federal government was trying to buy it. I'm bidding on behalf of New York. We're bidding against other states, Texas, California, Other states across the country are trying to buy the same masks from the same vendor. We literally wound up bidding up the price. I'm have people in China. I'm trying to contact people in China who can figure out how to buy masks from China. It was totally inefficient and ineffective. State of Massachusetts, Governor Baker was good enough to work with Robert Kraft, who had a personal airplane that he sent to China to get masks. And Massachusetts was good enough to give us some of the masks that a private airplane picked up. I mean, this is not the way to deal with this situation, right? Plus, we just drove up prices by our own competition. There was a limited supply. It was primarily in China. And then you have 50 states and all these private entities and the federal government trying to buy from China. It made no sense. So let's fix that. New York State alone buys about $2 billion of medical supplies this year. $2 billion this year. And that's one state. And that's us purchasing from China and around the world. We're going to form a consortium with our 7 Northeast partner states, which buy about $5 billion worth of equipment and supplies. That will then increase our market power when we're buying. And we will buy as a consortium, price as a consortium for PPE equipment, ventilators, medical equipment, whatever we need to buy when you put all those hospitals together, all that public health capacity together, which will make us more competitive in the international marketplace. And I believe it will save taxpayers money. I also believe it'll help us actually get the equipment, because we have trouble still getting the equipment and just buying the equipment, because these vendors on the other side, they're dealing with countries, they're dealing with the federal government. Why should they do business with one state, right, when they can do business with an entire country? So this consortium, I think, will help us get the equipment and get it at a better price. We will come up with a regional identification of all the equipment we need. Basically, it's all standard equipment. A mask is a mask, a gown is a gown. Let's come up with a total amount that we need. Let's stop doing business with vendors who we found to be irresponsible, and we found out the hard way. I can't tell you how many orders we placed with vendors who were acting basically as brokers, who just started businesses in the middle of this pandemic because they saw an opportunity. So let's compare notes among the states to find out who was good to do business, who was not good to do business with. Let's see if we can't do the purchasing in this country, and let's see if we can't do the purchasing in this region. You know, why are we buying all this material from China? Literally billions of dollars of PPE. And we'll do it in coordination with the federal government. But I want to thank our neighbors, our neighboring states. The word neighbor has a different connotation. You don't normally think of the surrounding states as neighbors. You think of the person next door as a neighbor, but they are neighbors. And they've acted as neighbors. I can't tell you how supportive Governor Murphy in New Jersey and Governor Lamont in Connecticut and all the other governors in our coalition have been. Literally, where you can pick up a phone and I can say, I need help with masks. Do you have any extra masks? Do you have any extra gowns? Can I borrow this? Can I borrow that? Really, the way you would deal with a neighbor in an extraordinary circumstance, right?